Okay, we're going to get started. It's 5:04. Jane, maybe you and Mayor will send out passwords and let people in. Um, we will get going. Uh, First of all, I'd like to start off by saying that the input from the community was incredible since our meeting last week. The comments, the questions, much appreciated. And there were hundreds of them. And we're gonna get to all of them. Secondly, before we start the agenda, I want to, so I don't forget, I really want to thank the people that have worked extremely hard over the last week in pulling all this together, because the emails and questions and calls were huge. So not only the IHP staff, but Margaret Bankard, Mekki Kuipers, Amelia Regal, Nick Wilmerding, Vijay Pahik, Jane Ahrens, Ginny Wilmerding, and all of you that obviously communicated with us. It was just amazing. So we want to thank you for writing in about this COVID-19 summer protocols and on Fishers. As I said, we've received a large number of questions and comments, and we're working hard to complete and digest them and integrate them into the next round of the plan, which we've committed will be finished by the 9th of June, so that people can make their plans. We had originally said June 15th, but we moved it up to the 9th. Our priority is to publish something for the entire community, and it's our priority to do that. But to do that, we may not be able to answer every question individually. So the agenda today will be that you're going to hear quite a bit from me, I'm sad to say, but I'm going to try to go through and highlight and summarize sort of the questions that we have received, and we've categorized them. And then we're going to ask, we've improved the infographic, and we've created a one-pager, and Dickie Regal will present that, and we will pull it up on the screen. I think we'll answer an awful lot of questions, and those that we don't answer, we will answer in the FAQs that we're finalizing to be published hopefully on Friday. So with that, I'm going to ask once again all of you to opt into this process. I'm going to ask all of you to communicate with your friends and neighbors who have not necessarily been on these calls to opt into the process. We on the ICB and the IHP are working hard to simplify the message. We got a lot of input that maybe it was too detailed and too confusing, but by giving you a detailed presentation, I think it really helped in getting questions and getting some really thoughtful ideas. So with that, bear with me, and I'm going to go through sort of the key 6 or 7 issues that came up in the last, since the last meeting. One question that came up a lot was arrivals by air and public transportation. And we want to make it clear that you have multiple options and should use your best judgment. The testing issue is pretty simple. We want everybody to be tested. We're working on getting testing at Fishers Island. But in the meantime, you can be tested if you're driving from Greenwich or you're driving from Darien. you can be tested 1 or 2 days beforehand at any Yale New Haven affiliated hospital. Chris can make that happen. So that can be Greenwich, it can be New Haven, it can be Bridgeport, it can be Westerly, Rhode Island, or it can be L&M. Number 2, if for some reason you're flying in and you can't get tested, or you're afraid you won't make the ferry, even though Susie told us last week that it took her 10 minutes. If you can't get tested, then you can come over on the ferry to Fishers, quarantine yourself, and go back to L&M and get tested 2 or 3 days later. As long as you're quarantining and doing the social distancing. So a day trip to L&M for the test is a definite option. We also are working on having saliva tests on the island, and Chris will speak more to that shortly. Another part of the question on arrivals by air and public transport was that the difference between day trippers and if you come to stay. And we'll get into this a little more, but if you're coming to stay, you get tested, and 6 to 8 days after you've arrived, you can expand your cohorts to be with all the others that have followed the same protocols. If you're a day tripper or you're coming for the weekend, expect that you can't expand your cohorts. And there were a lot of questions on cohorts, and I'll get to that in a minute. The second area where there seemed to be a lot of confusion, and we will summarize this at the end with the summaries that Dickie will present, is confusion about the enrollment and registration. You know, our 4 pillars are the first pillar is enroll. And enroll is a catch-all term that includes 3 actions that we want you to take. Fill in the Fishers Island COVID-19 census each and every time you come. Register with the IHP office so that they have a medical record for you. You're not going to lose your other records, even if you're with my chart with Cleveland Clinic. You will just have another chart. You won't lose that record. You'll have another chart with Yale New Haven affiliated hospitals. Download and enroll in the Yale New Haven MyChart app, which IHP can help you do. But it is awfully easy to do it on your own, and you should do it. And what we want to make sure is that when you do the census, you're showing when you arrive and when you leave. And if you know it in advance, fill it out in advance. Once again, those who come for a day or a weekend for both work or pleasure should fill out the census each time they come. Links for the census are on fishersisland.net, and you'll see shortly that we also have a way you can link in right through your iPhone. Testing options was another big topic that an awful lot of people asked. Well, what if I get tested 2 weeks in advance? Or what if I'm flying in from Houston? And it just numerous questions. We know that there is a lot of anxiety over the testing logistics and missing the ferries. Please know that you do have options, as I mentioned earlier, and we want you to use your best judgment. Also, we are hoping that the ferry will expand its schedule to include more 6:15 p.m. boats, which will then make it easier to make the ferry and to get tested in L&M. The other thing is that we've gotten a lot of questions about the testing. We want everybody in the family to be tested. And even the youngest children should get tested if possible, because the tests are 98% effective. And I think we understand that anyone over 2 years old should be tested. On the island testing, everybody said, well, why can't we have on the island testing? Why can't we have? And as I said, Chris will speak a little bit more on this in a minute, but we've heard all of you loud and clear. Yes, that would be the best thing we could do. And we're trying to get a supply to do on island testing. And in the meantime, we want you to plan to get tested at L&M or another Yale affiliated hospital. And as I said, and I'll repeat again, if logistics are such that you need to come to the island and then go back and get tested, you can take an early morning ferry and be back on the midday ferry, and they can schedule those tests, and it's very quick and very easy. The next item was cohort, the definition of cohorts. The best way to think about cohorts is that they are the ones you live with or have decided to interact with indoors. Once again, cohorts are the ones that you live with or have decided to interact with indoors, that you're comfortable being less than 6 feet away in closed space with those people, because you know who they've been in contact, and vice versa, they know who you've been in contact. So outside your cohorts, then social distancing is the protocol that we want everybody to follow. Another question that came up quite often are clubs on the island. IHP expects to work with the clubs on their protocols in the coming days, and they will publish the clubs will publish recommendations. We do know that the clubs are supportive of the enroll, test, check, and protect plan, and are urging everyone to opt in. We know that there is a degree of inconvenience in this summer plan, but we urge you to follow it anyway, because it's in the best interest of the community. The last thing we need is getting 4 or 5 or 10 or 20 people on the island sick, and then it could shut down the whole island for the summer. As I mentioned, we're going to have a new, shorter FAQ, which is going to follow frequently asked questions, which is going to follow the new summer protocol, and will address a lot of the questions. We also want to comment about stores and businesses, and I think I mentioned this last week as well. The new subject is that now that New York State is opening up, and that is and has protocols for businesses and stores with street footage and indoor spaces, retail stores will be allowed to open in New York or in Fishers when Suffolk County enters phase 2. New York Governor Cuomo has issued an executive order that permits stores to deny entry to people who refuse to wear masks. People may choose to put themselves at risk, but they don't have the right to jeopardize the health of others. And business owners need the authority to protect themselves and their customers. New York law requires each of us to wear a mask in public. So wear a mask at all times in our stores and stay 6 feet apart from other shoppers. The shops are going to be doing their best to sanitize their stores before and after receiving shoppers and visitors. They may provide and ask you to wear disposable gloves in the store. They may limit the number of customers at one time. We would ask that you comply closely with all requested protocols as business return to normal here on Fishers Island. It's too early to comment on restaurants, but certainly they're going to have to follow the New York State protocols as well. So arrivals by air and public transport confusion about the enrollment and registration, testing options when and where, and the logistics, on-island testing, cohorts, clubs on Fisher's Island, and businesses have been the key sort of topics or subjects or categories that 90% of the questions that we've received have been about. So we decided that it would be helpful for all of you, and these will be posted, if we had a really simple and direct and clear infographic and an executive summary of the enroll, test, check, and protect protocols. So with that, what I'd like to do is have Mare share her screen with the infographic first, and Dickie is going to speak to both the infographic and the executive summary. There you go. Okay, the executive summary there you go.
Thank you, Willard, and thanks, Mayor. Yeah, this is the infographic. As Willard said, first off, it's great to see just south of a couple hundred fellow Fishers Islanders on the call here today, and thanks everybody for your participation. It's sometimes hard and probably confusing. There's a ton of information coming at us, and even participating in a call like this on a weekly basis, it's sometimes hard to decipher everything and what it means to your particular family or your particular situation. Chris did a great job last week with the students, and Vijal taking us through much more of the detail and the rationale behind it, but presented here in 2 pages, which are being printed and will be posted around the island, is a much simplified, dramatically simplified way for everybody to understand the protocols at hand and how we envision entering into a safe and healthy summer. The first thing that you will see here, and by the way, I'm really presenting this on behalf of the 3 students, Mecky Kuipers, Nicholas Wilmerding, and my daughter Amelia, who have put the vast majority of the work into creating all these protocols. So what you see here are these 4 pillars, and you see it graphically: enroll, test, check, protect, with very simple directives here. Hopefully everybody can memorize it and sort of understand these 4 simple directives. A couple of things that I will point out here on this slide: in the enroll section in the upper left, the light green section, there is a QR code. Some people may not be familiar with how the QR code works, but it's as simple as holding up your camera, and when you take a picture with a smartphone of a QR code, it links you directly to the website. So it's that simple. You can walk up to the post office bulletin board, hold up your camera, take a picture of it, click, and all of a sudden the Fishers Island, New York COVID-19 census will be on your phone. You can also, the website is there on that screen as well. So that's a key thing. And again, thanks to the students for making it so simple and easy for everybody to do that. Everything else is really here and pretty self-explanatory. Please take a look for these. They will begin being posted as of late Thursday, Friday, and over the weekend. Mayor, can we go to the second page? So complementing that 4-box infographic is, again, a very simple executive summary. And the objective here was, the old KISS protocol: keep it simple, stupid. If we can't simplify this, make it understandable for everybody on the island, we will thwart our opportunity for adoption. We want everybody to follow these protocols. There's a lot of work that has gone into it. Chris Ingram and the Island Health Project have really put heart and soul into making this simple and easy. So it corresponds with that 4-box graphic that I showed you just a minute ago: enroll, test, check, and protect. And I will take the moment just here to read this, each of these 4, so that you can hear how simple it is. Under enroll. The most important part of the plan is for everyone to fill out the Fishers Island COVID-19 census. Call IHP to sign up for the Yale New Haven Health on My Chart. It's a medical record and patient portal. This is essential for healthcare delivery over the summer. Test. Arrange testing for everyone in your group by calling IHP well in advance of your arrival. Preferred testing is on the day of your arrival to the island, at a Yale-affiliated testing site, or on the island when that testing is available. It's at Lawrence and Memorial in New London or any other Yale-affiliated facility before arriving, and those include Greenwich, Bridgeport, New Haven, or Westerly, Rhode Island. You can also go off the island and go back to L&M in New London shortly after arriving on the island. And we realize not everybody will choose to test. We hope you will, but if you choose not to test, you can quarantine for 14 days. The purpose here is to establish that people don't have COVID. Under check, if symptoms arise, Dr. Ingram needs to know as soon as possible. To accomplish this, please respond to the automated Island Health Project symptom tracker email, which you will receive 3 times weekly. The tracker is so simple. It takes less than 10 seconds to fill it out and submit it. Under protect, we ask that everyone follow New York State recommendations. Wear masks in public, please. Social distance, please. Isolate if you're symptomatic. You must do that. And cooperate with Island Health Project contact tracing if positive tests do arise. We provide the links and the phone numbers at the bottom. We think that this is a simplified document to give everyone the same guidelines, makes it easy, and we hope everybody will participate. Thank you.
Thanks, Dickie. Great job. And I just want to underline something. If you choose not to test, and we've asked everybody to test, but we understand some may not, that does not mean that you don't fill out the census. And that does not mean that you don't opt into the symptom tracker, because those two things are critical. And responding to the symptom tracker emails on a weekly basis are very, very important. With that, Dr. Ingram, are you available to make some comments?
Yes.
You want to mention about the work we're doing on trying to figure out some testing on island?
Sure. So, in fact, I was on the telephone today with the company out in California, which is providing us with some tests. Yesterday, I purchased 20, which will be here in just a few days. And these are a slightly different kind of test. It's a saliva test, and it is self-administered. So it's kind of perfect in that respect. So the number that we have are limited. The number that we can get, I believe, is relatively unlimited. One catch is they're about $110 a piece. The turnaround time with priority mailing is about 2 to 3 days. So I think that we can consider that to be pretty good. The accuracy is, in fact, better than the swab. And what else? So there's the use of these, I think, are a few. One, it can supplement testing that we do on the mainland. For those who, for whatever reason, can't do it, this would be another option. I think more importantly, I would like to use this if we have a potential positive person, and to be able to test the people that person has been in contact with, or to test people who develop symptoms on island when we don't want to, be having them travel over and whatnot. So I don't really want this to be an alternative to the off-island testing, but it should be a kind of a supplement to it. One thought that I've been having, especially recently, as testing has become more available, is that, you know, we might find ourselves in a situation where we can test and retest. And I think multiple testing would be the best option for continuously combing through the community, looking for that lone, hopefully lone individual who was able to slip through, you know, these gaps in our protocol. So I would like to be liberal with these tests and make them readily available. And in addition to that, we've been talking about another testing option, which I'll tell you more about when and if that develops. So another thing I wanted to mention was that we indeed had a contact tracing episode in the last few days. And I'll briefly tell you sort of the circumstances around it so you can see somewhat the complexity, but also that the number of people that ended up getting involved in this. So this is about an individual who works at one of our clubs. He lives off island in Connecticut with his daughter. His daughter had been staying with her boyfriend the week previous to that. She left him, moved back in with her father. The boyfriend went for a viral test that he needed to get back to work. He tested positive. So she, in fact, was in his presence with the virus. So she was, you know, a primary contact. But by virtue of her father living with her, he is what we call a contact of a contact. Well, he had been on the island and he had interacted with 4 or 5 individuals. Luckily, they were all masked. They were, for the most part, outside. There were a few minutes indoors, which increases the risk of infection. So he went into quarantine. The individuals that he met on the island went into quarantine, as did their families. So, the daughter was tested and he was tested. Luckily, after 2 days, those tests came back negative, and then the quarantine was lifted for all. But in general, that meant a good 15 people were put out of commission for 3 or 4, you know, days. So, you know, that brings up a couple points. One is these this contact stuff is extensive, and it could have been far wider than that, in fact. The other thing is it shows you the value of maintaining a tight cohort. If that had not been the case, if these individuals had interacted outside of their family groups, the potential number of contacts would be exponential. So I'm urging everybody to establish cohorts and really stick to them. And then when interacting outside of the cohorts, use the social distancing that we've been talking about to date. One last thing I would like to re-emphasize, since I haven't said it for a while, is that we really want to use the sea stretcher as sparingly as possible. It uses up a lot of resources when we put the boat, launch the boat. And so we want to depend primarily on the ferry for transport. Obviously, if the case is severe, we're going to use whatever we need to use. But in many cases, we use the sea stretcher when somebody needs a higher level of care. But it's more due to the fact that it's a logistical thing. It's after hours. The ferry is gone. We really don't want to use the sea stretcher for that purpose. So what I'm urging you is, if you're feeling unwell, most people, you know, you know, they begin to feel unwell, you know, throughout the day, call me early so that we can make a decision as to whether you need to go over or not. Let's not use the sea stretcher if we don't have to, just as a transport mechanism. You know, if you're stable enough and it's early enough, we can get you on the ferry and get you over to the hospital. So
Thanks, Chris. Two points that I also wanted to stress, and I know Dickie Regal did this already, but I'll restate it. Speaking of the sea stretcher, you know, the Memorial Day fun run didn't happen this year, and that raises money for the sea stretcher. So the IHP and the ICB hope that everybody will realize that and maybe make the contribution as if they had run in the race or walked in the race anyway. The second point that I meant to mention and didn't was that a question that comes up a lot is, what if family's here for the whole summer and one of the spouses goes back to New York or comes up for the weekend and goes back to, and then leaves and comes back over for the weekend? Why should they get tested? And there's two choices here as we see it. One is don't get tested and just be the commuter and social distancing, but that means your family and your children have to limit their cohorts to just the family. Whereas if you come up on, let's say, a Thursday, you get tested and you have to limit you being the commuter, have to limit your exposure. But if the test comes back negative on Monday or Tuesday, your family can then go and expand their cohorts. So we want to be flexible here, and we want to have you understand as many options as possible. And with that, one of our goals by Friday is to have a detailed, and I think I mentioned this, FAQ. And I'd like Ginny Wilmerding to just give some highlights on what you can expect on that. It's going to be a simpler, shorter FAQ, and it's going to, I believe, relate to the questions and the thoughts and the comments and the input that people have provided. But Ginny, could you make a few comments on that?
Sure. So those of you who were reading these documents in the spring, we did 7 versions of like an advice for people and an FAQ. And what happens is those keep getting longer and longer and longer. Now that we're out of the spring situation, which is kind of different, and in the summer situation, we're revamping from scratch. We are going to use only the bits and pieces from the old advice that still makes sense. You know, we'll be deleting the stuff about the 14-day quarantine and things that everybody kind of knows by now. And so we're combining information about the program, so it'll be longer than the one-pager that Dickie presented. Just a little more information about the program, similar to what was in the PowerPoint. And then major areas of questions, and we will base that on the feedback that we've been getting. Things like, you know, summer arrivals and testing based on the latest testing situation. But big sections of the old document will still be there, like all of the medical information, you know, which hospital we're affiliated with, which numbers you should call, depending on whether you have major or minor symptoms, what should you do, and a little more detail about if you are symptomatic, how should you isolate. Some of the stuff that was in the last few documents will stay in this, but we're going to try and keep it relatively brief, and we may have to update it. You know, in the past we found we had to update that once a week, but it may or may not be that frequent. We are taking all those questions that you send into IHP and compiling them for everybody on the committee, and we're trying to answer them in a concise way so that you can find the answer to your question in this document, and maybe you don't need to send us an email, because we've just found we don't, with all the, it's all volunteers, and the IHP office is very busy, so it's harder for us to answer a lot of individual questions. So we will try to make it comprehensive and not too long. And if we're missing something, we'll add it.
Great, thanks, Jenny. And just to repeat, I mean, thank you to the student group for compiling a lot of this material. I think that we have, I printed it out, I think it was 18 or 20 pages of questions and input, number one. Number two, as I think Chris mentioned earlier, relative to any HIPAA concerns, the information that, well, the student group is working for IHP. They're being directed by Chris and by Vijal, and both Chris and Vijal are making sure that all HIPAA rules and are being followed. So you don't have anything to worry about there. With that sort of ends our formal presentation. It's 5:40. We will open it up, the chat room. Please send your questions to either Candy Whitman or to myself. We will pose the questions and answer them if it can be, and sometimes it probably can't be. The first question I have, and I won't ask for an answer on this yet, but will the ferry cost be waived for same-day travel to get tested? And I'll just pose that as a question that we can answer at a future time. The next question is for Chris. What if you have tested positive for the antibodies? Do you still need to get tested for COVID? Which is a great question.
So my answer to that would be yes, you do need to be tested. The reason being is that we don't really know what the antibodies mean in terms of how much they confer immunity. So it's conceivable that you could have be positive for antibodies and yet still get the disease again. On a slightly different note, I hope that answers that question. I failed to mention that the saliva tests that I have, we don't have a mechanism yet for that to be covered by insurance. So that would be an out-of-pocket cost.
Right. Another question I have is when will compulsory testing start? Well, nothing's compulsory. It's an opt-in, but we hope you will opt in, and it started. Right, Chris?
Yes, maybe I'll make a mention to that. There's a lot of people, obviously, that have been on the island for months. Probably the question is, well, if you've been here for months, isolated and stuff, do you need to be tested? Well, I think that you would be the kind of the lowest priority testing for testing, given that you've proven yourself to be virus-free by virtue of not having been symptomatic during this time period. Could you have had it and been asymptomatic? Yes, but in that time period, you would have cleared the virus by now. So.
Great, thank you. Candy, do you have any questions that came to you?
Well, I have a couple, yes. Well, one question just on, for people who are year-rounders who have been here, but may have had to go off island and they were very careful when they went off island, say for a day, should they be tested? And do you have a preference for when and how they do that? Chris?
Do you know what? I was actually reading a note on my phone. Could you just repeat that real quick?
Sure. So for year-rounders who may have gone off island actually a few times since they've been here, do you have a preference for their testing protocol?
Yeah, I think in that case, then they sort of fall in the category of everybody else, and they should be tested. Again, I would like everybody to test and to retest and test again if that were possible.
Okay, thank you. And also another question came in about wearing masks. If you're with a group of people outside, or if there are kids outside playing and most have their masks but not others, or one doesn't have a mask and the others do, is that safe?
Is this for me again?
Yeah, I think so.
Okay. Well, no, I think that I think everybody needs to stick to the protocol. If they are within a cohort, then masks aren't necessary, nor is the 6-foot distance rule. But if they aren't, then they need to, follow the social distancing.
And I think that that's a very important point that we all need to be aware of. It is very possible that a family has been together for 2 months and they're fine, and they can be out playing on the beach or out playing on the ball field, and as long as they're not expanding their cohort, they don't need masks. It's when they're in public with other people that where the masks are important.
I think one of the other things about the masks that we talked about was N95 masks versus just regular masks. We're trying to, I mean, regular masks are fine. Homemade masks are fine. I think any kind of mask. I know it's going to get hot, so I think trying to get something comfortable is also easier for children to comply with. So,
Right. A couple of other questions here. One is it possible to get tested outside the Yale New Haven Hospital system? And the answer right now is no. It's possible, but we'd rather have you, but it's not going to work for what we're doing. How realistic is the 10 minutes to get tested at L&M? Well, I think that Susie and Bobby Parsons did it, and it was 10 minutes. I heard somebody else did it, and they said it was 4 minutes. So
It's very easy.
I'm
Very
sure
easy.
somebody that's going to say it was a half an hour, but I think that the 10 minutes to a half an hour seems to be in the ballpark. Here's a question for our whole group, and I think we may have to come back and respond to this afterwards, but it says, I understand that there is an employee whose girlfriend comes over and spends a night occasionally. How can this be dealt with? I think that the obvious answer is that then the person needs to social distance and not expand their cohort. But Chris, do you want to try to answer that?
No, I think you're right. One of the things that I am hoping that we can do with the on-island testing is when people have exposures that might render them kind of unacceptable to be out in a larger cohort, that they essentially quarantine or social distance for a number of days, and then retest. For the $100 that it costs, it really can buy you a lot of freedom and give those that you're with the confidence that you haven't been exposed, and thus could be exposing them.
Yeah. Okay. Let me just see.
I have
Andy,
something.
you got a few more? Give me time to read these. Go ahead.
Sure. Well, a couple of questions have been sent to me, Chris, about a year-rounder who might go over town for a day. I suppose that pertains to anybody who's been here a while. Do you have to get tested on your way back? So if you're just going over for a day, you need to get tested before coming back to the island.
So, to some degree, that would be impractical. I think, you have to have some notion of what your exposure was. If you go across and you're meticulous in controlling exposure, I think it's just reasonable to say that that wouldn't require retesting. If you've gone over and you're rubbing elbows in the supermarket or at open restaurant, of course, then testing immediately on your way back doesn't really cover that exposure, but that would be the case where then you would quarantine back on island, and then either go back over to the New London to get tested, or if we've got the supplies that we could test on island. But for instance, the individual going for a doctor's appointment where the environment is highly controlled, or a single shopping event where you're hyper vigilant, then I would say that wouldn't require retesting.
Another
you.
point of clarification, which I think we need to make, and everybody should know, is that so you contact IHP, you then let them know when you would like to get tested. And then the Yale system will call you, and it will actually ask you which hospital you want to be tested at. And it will make, and the Yale system will make an appointment for you with them. So the IHP sends in the order for the test, and then a person at the Yale hospital system contacts you and sets up the appointment with you. And you could say Waterbury, you could say Bridgeport or Greenwich or New London or New Haven. So because there's a lot of questions about that, and I think that's the easiest, that's how the system works right now.
Willard, can I add to that?
Yep.
There is a number too that you can call to take the lag time out of the between when I order it and when you actually receive the phone call. It's conceivable that somebody would miss the call or whatever. We can give you that number so that as soon as the order is put in, you can actually pick the phone up, call them, tell them where you want it to be, where you want to be tested, tell them exactly when you want to be tested too. And I've not heard anybody not being accommodated.
Chris, can I just add to that for 1 second? I don't want to urge people to wait until the very last minute, because if I have to register the patient, first of all, we're only open on Monday evenings, Tuesday, Thursdays, and Friday mornings. So we have limited hours. Please don't wait until the last minute and say you're coming tomorrow and need a test, if at all possible. I know there are some situations that happens, but it really puts a big strain on us trying to get you in the system, getting the test ordered, and then trying to track somebody at Yale to get the test ordered. So please don't use that as a common occurrence.
Yeah, good point, Di. People usually know their schedule 2 or 3 weeks in advance, and hopefully they'll contact you as soon as they know their schedule. Candy, any other questions?
Yes, there was a question about the ferry. I don't know, is Jeb or Ace on by any chance?
Jeb is.
Oh,
Yep.
okay. Maybe, Jeb, yes. So for a while you had a essential goods only policy for your freight office just to cut down on how much stuff was coming in. Is that still in effect?
Essentially not. It's open. You can send stuff.
Okay. Thank you.
Okay. Susie Parsons, anything to add?
Yes, I just want to say thank you to everybody who's worked tirelessly on this. And this is an unusual time, and it calls for unusual measures. And ICB and IHP are asking everyone to join together and follow our recommendations. We want you to respect others, get tested, wear masks, social distance. We want a safe and healthy summer on our island, and we need to thwart this terrible virus. And as Candy Whitman put on her sign outside her Union Chapel, do the next right thing. Thank you, Candy.
That's great.
It came from Diane Dexter. I don't want to take credit for her.
Good for Diane. Thank you. Do the next right thing, everybody.
Thank you, everybody. Great. Do we have one? Mimi Gary, did you have a quick question or comment?
Nope,
Okay.
I didn't. Did you want me to say something?
No, that's fine. That's good. Thank you, everyone. Another good meeting. I hope this has helped, and I hope that you'll get. We'll have the summaries out to you on Friday or Saturday at the latest, and we'll see you in a week. Thanks, everybody.
Thanks, Willard.
Thanks, guys.
Thanks, Willard.
Thank
Bye,
you all so
everybody.
much.
Thank you.
Bye.
Thank you.